Hey class, Cody Rowland here. Everybody loves sports, right? Well, that's what got me into the profession of athletic training. That along with an injury that I sustained in high school. Have you ever had a serious injury? If you have, I'm sure you understand what athletic trainers are, physical therapy, or some idea of the sports medicine world. As an athletic training student, I deal with that firsthand. For 3 years, I've spent time at clinicals learning, the processes and the responsibilities of athletic trainers. Athletic training is a profession that allows someone to serve athletes both physically and emotionally while enjoying the joy of being around sports. I'm going to teach you guys a little bit about the responsibility of athletic trainers, like the prevention of injuries, evaluation of injuries, and like the rehab of injuries, kind of the treatment side of that too. That's helps athletes stay healthy and just gives you a little overview of what athletic trainers do. So let's just take a dive into the hectic life of an athletic trainer. So first and foremost, one of the domains of athletic training is prevention. So part of medicine is not just treating the injuries, but trying to prevent it. So that goes with, you know, proper fitting of equipment, training people in proper techniques. If you see something wrong on the field, you're like, hey, that's not how you're supposed to throw, or that's not how you're supposed to, land when you jump. It's kind of like biomechanical correction. And then the latter half of that is with like weather related conditions, heat and humidity. We use like a thermoglobe in it, or different, I guess, procedures to figure out if the weather's safe. Look out for lightning, just simple stuff like that. But hey, somebody's got to be in charge of it. And then also brace fitting, a lot of things that people relate to athletic training that they think the only thing we do is tape, but there are a lot of tape jobs that we do, ankle tapes, wrist tapes, finger tapes, knee tapes. I mean, you can get creative with it, and pretty much as long as it works, create any kind of tape job you want. That's kind of fun part of the side of the profession. But you can't always prevent injuries, and when failure to prevent them, injury is going to occur, and that puts stress on the body, and that's where like the evaluation side comes in. Athletic trainers need to be able to evaluate injuries, recognize what they are, diagnose them, and figure out how to properly treat them. So that goes along with, a simple ankle sprain to someone coming in and saying their knee hurts, and you've got to take a look at it and figure out, okay, is it muscle? Is it ligamentous? Is it bony? And there's like a lot of procedures that go through that. It's actually called HOPS is what we do. So we take a history, observation, we look at it, we go through palpation. So, we're feeling the structures, we know what to feel for because you know what healthy feels like. So you should be able to tell what unhealthy feels like. And then special tests. So that goes through range of motion. So seeing, how the joint feels in certain planes, and manual muscle tests. So testing the strength of the muscles, being able to put that muscle and isolate it so that you can test, one of the quad muscles, like the vastus medialis versus vastus lateralis is just a simple turning of the foot to elongate the muscle, or special tests, so like testing certain ligaments, like something everyone knows is the Lockman. So, I'm putting a posterior force through the femur and I'm pulling anteriorly on the tibia to find an end feel for the ACL. And I know what a healthy one feels like. I also know what a torn ACL or partially torn ACL feels like, just due to experience. You're really just, mimicking what the ligament does to test its stability. So after injury and after we evaluate it, we go into the rehabilitation phase, and this kind of includes treatment. So there's 8 phases of rehab that we like to go to. I can give you a quick overview. It looks like starts with reducing the pain and the inflammation, so just getting the athlete comfortable, reducing the swelling, want to control that. And then we go into range of motion, so just getting normal movement back. And then we start to kind of improve their strength, their endurance, power and speed, neuromuscular control, so just balance, things of that nature, like proprioception and kinesthesia. And then it gets into like sport specific and plyometrics, so like really explosive movements, and then applying those explosive movements to the sport that the athlete is in. As you can see, there's a lot of levels to athletic training. I kind of gave you an overview of 3 or 4 of the domains. There's also administration, but that's the boring stuff, just paperwork. It's pretty hectic, it's pretty busy, but as you can see, you can demonstrate love and compassion and really serve athletes like physically and emotionally, because there's a lot of emotion going into injuries and going back and being away from the team. And it's a good way to be around sports and a good way to serve people. So having a servant nature is very evident in athletic training. And I'd just like to challenge you and say, how could you be a servant in the profession that you are going into? Thank you, guys.